So we want to look at the body's hormone levels. The most common test, the TSH. We want to look at it not as based on is it in the normal lab range, but we really want to have an idea of where optimal values are for the thyroid hormone function. So we want to go for optimal or functional lab ranges, and these ranges tend to be more narrow. Over the years, the TSH level that's been considered abnormal has come down. I remember years ago it used to be 10, and it's now down somewhere between 4 and 5. Anything above 2 is really not normal and should be looked upon with suspicion and evaluated further. So when we look at thyroid hormone function, we are looking at a full picture. So a full picture is going to involve these 5 hormones. It's going to involve the TSH, the T4, the T3, both in their free forms, as well as the total T3, which can be then compared to the reverse T3 to calculate the ratio. So the T3 and the reverse T3 really show how well the T4 is being processed. So in this patient, the ratio would be 124 divided by 11, or 11.3. So this patient has a good ratio, and her TSH is right around 2. So this patient does not have a significant thyroid problem. So going further beyond just the hormone levels, let's say we do encounter a problem, it's important to look for underlying causes. So is this primary hypothyroidism where the thyroid for whatever reason is not working? Is there a nutritional deficiency? Is there some sort of a toxic or drug effect? There are medications that will negatively impact the thyroid. Is it because the pituitary is not working? Is it because that T4 is not being activated? The testing will help us to determine that. Is the problem because the patient is on oral contraceptives and therefore her estrogen levels and her hormone binding globulin levels are high, and the thyroid hormone is there, but it's just being tied up, so it can't work? Is there an autoimmune problem? And the only way we're going to know that is if we go beyond these 5 blood tests for thyroid function and look at antibodies. There are antibodies that can be looked at to evaluate both Hashimoto's and Graves' disease. In the US, the majority of thyroid symptoms among women are due to Hashimoto's thyroiditis. Now, it's important to remember that these are not just thyroid problems. These actually are problems of the immune system. Hashimoto's is the very first autoimmune condition that was recognized. In Hashimoto's, the immune system is generating antibodies that damage the thyroid gland, so it cannot work properly. In Graves' disease, the antibody is either going to act like a blocking antibody, so it blocks the effect of TSH, or it's going to stimulate, it's going to act like it is TSH. So a Graves' antibody can cause what we call hyperthyroidism, where the thyroid goes out of control and is hyperactive.